Ever go to the dental office and wonder why your dentist won't pull your tooth? Or why they won't do the root canal? They seem like they refer everyone out. Refer them out. Let's refer them out. Why is that? Why doesn't the general dentist just do the procedure themselves? Let's get right into it. Hey guys, Smile Doc here. I am so glad to be with you today to make this video, and I hope that it answers your questions as to why your dentist won't pull your tooth. Can't they pull teeth? You know, your dentist, you might need a root canal, and you go in and they're like, oh, sorry, we're going to send you over to a specialist for that. And you're like, well, don't you do it? That's what we want to talk about today. Why won't the dentist pull your tooth? As you all know, there are many different specialties in dentistry: pediatric dentistry, endodontics, orthodontics, oral surgery, pathology, radiology. You can go into all of these fields within dentistry. A lot of people didn't know that. In dental school, we actually learn how to do them. I know how to do extractions, so why won't I extract all the teeth that come into my office? I learned how to do endodontics. Heck, for my board exam, I had to actually do a root canal that had to pass with an endodontist looking at it, making sure everything looked good. So I can do root canals. Why don't I do a lot of them? Well, we're going to talk about that. So there's a couple of reasons, okay? And let's go back to like when I was in dental school. When I was in dental school, they had an oral surgery residency, okay? They had residents that would do all of the wisdom teeth extractions. Well, because of that, I never got to see one wisdom tooth extracted. Never, not one. That's a total disservice. A total disservice for dental students, okay? You should be rotating through these oral surgery with the residents, seeing everything that they do, being exposed to all that stuff. It's good common knowledge as you're gonna be seeing all of the patients at first and fielding these patients or screening these patients for the specialist in which you're going to refer. It's good to have the knowledge, and the fact that they keep that away from you is lame. Okay, I said it. To contrast that, in my dental school, we did not have an orthodontic residency, okay? They do now, but at the time they didn't. And so as undergrads, we did all of the orthodontics. It was a requirement that we did 2 cases, start to finish, with braces, the whole cephalometric analysis, everything. We had to do all of it from start to finish before we could graduate. So I knew how to place brackets and stuff like that. I know dentists right now who went to dental schools that had orthodontic residencies at their dental school. They didn't do any ortho. They learn about it in theory, they see the cases, but they don't do anything about it. Lame. All right, that is lame. Now, I do know, if I think bigger, let's think bigger. I do know general physicians who have a subspecialty in their practice or a sub-practice within their practice where they do obstetrics. A lot of it. It's something that they like. So after medical school, they continue to invest in their training and they deliver babies all the time. I also know some general physicians who really have taken a liking to dermatology. You know, inside of their practice, you'll see a skincare line. They do Botox and fillers and all that kind of stuff. So physicians are no different than dentists in this way. If there's something in particular that they like, they spend a lot more time doing it. And that's what they enjoy, and so that's what they build their practice around. I do want to share a story. We've all heard, jack of all trades, master of none, and when you get out of dental school, you're in debt. Did I say debt? I mean a lot. It's sick. Okay, it's grotesque. It's insane. The amount of money spent while in dentistry to get through dental school is out of this world. It is overwhelming. It is stressful. Okay, you get out of dental school and you have between $200,000 and $400,000. Nowadays, it's $300,000 to $400,000 worth of debt, and so you basically will do everything. All right. Yes, we do fillings. Yes, I do the extractions. Yes, I do the root canals. We'll even pull out some wisdom teeth from time to time, whatever, because I need the money. I got to pay off these bills. But when you start to become a little more seasoned, a little more experienced, the concept of a jack of all trades, master of none becomes very, very true, because you want to be very great at some things so that you can provide the very best service to your patients. You can't be awesome at everything. So you gotta kind of pick what you're interested in and then go all in with money and time and learn how to be the best. There's a story, I'll try to be very brief about this, about the clay pots. You could Google this. It's not a rare story. But basically in an art class, the teacher decided they were gonna make these clay pots, and they divided up the class. Half the class were gonna be graded on quantity, how many that they could do within the time frame before the deadline. The other group is gonna be graded on quality, how well they can make the pots within the time frame. And they ended up taking all of the pots that were made in the quantity group, and they did rate them on quality, and they separated them. And those that would have gotten an A on quality, they made a pile of them. Those that would have gotten a B, they made a pile of them. Those that, C and so forth. Then they took the pots from the group that were being graded on quality, and they evaluated them and rated them as an A or a B or a C. And what they found was quite amazing. The group that did the quantity had way more pots that got the A grade than the group that was based on quality. Now, why is that? It's because this group is just churning out the pots. They're learning from their mistakes, figuring out how to do it. Those pots were smoother. The shapes were more proportionate. Everything about them was better. And these guys who spent a lot of time on theory, making sure they had the perfect pot, taking their time, they only made a couple of pots, and they were just like lumps of clay. They just weren't good at all because they weren't refined. So the more you do stuff, the more you focus in on a few things, you'll be very much greater at those things than you will at all of the other things. I will say this, however, it's very, very interesting. If you take a general dentist, there's actually nothing a general dentist can do that isn't a specialty procedure. Sometimes specialists will get offended, like if a general dentist is doing implants or they're doing braces, the orthodontist might say, why are they doing braces? They didn't go to orthodontic residency. But if you look at the types of procedures that a general dentist does, all we do are prosthodontics. We might do Invisalign or something like that. That's orthodontics. We're going to see kids and we're going to do some pediatric stuff. We're going to do deeper cleaning sometimes. That's periodontics. All we do are general dentist procedures, and we're sort of trained to learn what is within our competency zone. That's the important part. What is in our competency zone and what isn't, we refer out to the specialists. And that's what they're there for. They're not there to do all of the procedures, do all of the endo. It's insane if they think that they are. That's not what they were taught in dental school. It's not what we're taught in dental school. The last thing I'll say is a piece of advice for dentists and for patients. If you're the dentist, figure out some things you like, dive in and be great at them, all right? I do a lot of orthodontics. I actually do braces. I learned a lot in undergraduate school, and then I get out of school. Of course, no dental practice is gonna have the armamentarium of doing braces, and so you're not gonna do a lot. But if you invest in it, you'll have all the stuff and you can do it. They do say, interestingly, they taught us this in dental school as well, two-thirds, more than half of all orthodontic insurance claims are filed by non-orthodontists. Interesting, right? And so you start to feel like, okay, of all the general dentists around the country, there's general dentists and pediatric dentists that are doing a lot of braces. And so it can be done. If you're really interested in implants, take some more courses and become really good at them, and you're going to be able to do implants. All right, so focus on the things that you're interested in and then become great at those things. As a patient, let me just say this, okay? Find out what your general dentist, he or she, loves to do. You may be interested in getting some partials done, and you might call up and go, hey, I need a partial, and they'll say, come on in. But if it's not their thing, find a different one, okay? If you're looking for a dentist that sort of does your root canals and your crowns all in one appointment, find a dentist that does that. You don't have to get what you get and don't pitch a fit. This is America. You can pick whoever you want. The insurance isn't going to help that much anyway. That's, I guess, good news. And so pick who you trust, pick who's going to do the job that you want to do, and then become a happy dental patient at that practice. All right. Don't forget to hit that like button and subscribe to the channel. We're going to keep providing these great videos for you as long as you remain interested. Thanks so much. We'll see you on the next video. Smile Doc out.